This is Dr. Din. For those of you who do not know me, I am an anti-aging doctor in New York. I work in Westchester County, which is like maybe 20-25 minutes away from Manhattan. It's a train ride away. I do see a lot of clients from Manhattan. I'm going to be on today answering some of your questions. One question that people really ask me all the time is, what the heck is anti-aging? Why, nobody has heard about anti-aging. And I'm like, where have you guys been? Where have you been getting your news? And the thing is that anti-aging is the health and wellness, the preservation of health and wellness for your future. And basically, the concept is that even though modern medicine has doubled and tripled our lifespans, but what it has failed to do for us is that it has failed to increase the quality and energy and life for the entirety of your lifespan. So usually people, as they get into their 5th or 6th or 7th decade, they just are to take care of themselves by themselves, and they basically have to sit like sitting ducks, basically waiting for different diseases of aging happen to us. One of the reasons and one of my main hobbies and purposes of life is to attend to people who are willing to preserve themselves time and through experience, not just for the few years that they're young and vibrant, but for the entirety of their lifespans. This is accomplished. This is a great feat that is accomplished not just with hugs and prayers and love, even though they are very important. What you also need is some great lifestyle alterations, like you want to be healthy, you want to move your body, you want to eat healthy, you want to sleep on time, and stay away from toxic bullshit, keep out of potential addictions and that are there to destroy your health. And then you come to the next level, which is you use some medications, some FDA approved medications and some FDA approved machines are usually administered to you by people like myself who have trained in this field for several years now. I retired as a geriatrician in around 2012, and since then I have been passionately learning about this field. What anti-aging is there for men? Anti-aging is for both men and women. Even though women, we are more conscious about ourselves. We can perceive, we're more connected with our well-being, so we can perceive when our system is breaking down, whether it is breaking down internally or if signs and symptoms of that breakdown is evident upon our external appearance also. So women are usually more aware of it, so women seek treatment for it more. However, both men and women are candidates for preserving all of their organs, not just few of their organs. Would IV infusions help with headache? Depends on what's causing your headache. We do have to figure out, but you want to make sure that you're hydrated or not. So the people who are always on the go and who forget to hydrate themselves throughout the day or regularly, they would benefit from these treatments. Is 30 too young to start Botox? Yes. The thing is that the reason I tell people to use Botox is whenever they start noticing signs of skin breakdown or skin aging, that is the time to start anti-aging medications, because there is no way for your skin to preserve itself just with topical lotions and potions, because you've lost weight, gained weight, then lost weight, then gained weight, or you've gone through so much stress that it has aged you prematurely, then yes, you should try Botox. And I would surely hope that you will go to somebody who's going to give you like really small doses of Botox. Now, the other thing is that can somebody get immune to Botox? Now, the thing is that the reason I don't want people to start it too early at very high doses is because you will really need to get some Botox when you're over 50, when you have hit the menopause and things are just about to fall apart, and that's the time that you really would hope that there are medications that you can use that can reverse your skin back to its original glory. Of course, there are people, because life has become so much more hectic than what it was for our ancestors, even though it has in many ways become better for us also, because we're so much technologically advanced. We have so much more medications, and guess what? Botox is also a form of medication. However, just like people get immune or resistant to antibiotics, they can also become immune and resistant to Botox, because that's the nature, that's the essence of human body. And whatever you give to yourself, eventually your body becomes resistant to it. So I always tell people that if you're younger than 40 or younger than 50 and you've not hit the pause yet, which is like, if you're a female, you're gonna get older, you're gonna peak at some point, then you're gonna maintain that peak for some point, and then you're gonna hit a pause in your life where your body is going, where your body is going to stop production of certain hormones and stuff, because that is an indication to your system that your time is up. And basically the original manufacturer guarantee that was given to you is over. So after the pause, usually people, ordinarily human bodies at that point experience and start experiencing a decline, because you're just, no matter what you eat, no matter how much you sleep, no matter what toxicity you don't expose yourself to, you will still feel that decline, because menopause or andropause, if you're a man, you're gonna suffer from andropause in your 50s. So at that point, what are the things that you can do to keep you lifted out of the pause? So at that point, that's the point when you need a lot of anti-aging medications. You need to start seeing somebody like me regularly. So basically, I do see a lot of younglings. By younglings, I mean people who are under 40. You are my younglings, because you guys are getting there, and I sure hope that you are not allowing yourself to fall apart, whether life has been hectic or not, or whatever is happening in your life. Because remember, circumstances are always external, and you shouldn't let your life get to you. So one of the things that I suggest is that if you decide to start using some of these medications early on in life, please make sure that they're being given to you in very tiny doses, so that you do not become immune to them when you actually need them in life. And that's basically the ideology of my company, and that's why there will always be some improvements that you will be seeking. Especially people who come to me, they do want either they want to preserve themselves as they are, or they want to enhance themselves to a certain level, because they truly feel that they can be better than where they are at, and then basically to maintain themselves for a long lifespan. So if you're in that category, the current recommendation is that you use it very, very mindfully, and not to go berserk, because I do see all the time people utilizing these medications and just overdoing it. Actually, if you go around, you will see big celebrities and stars being misguided into utilizing these medications as if this is popcorn that you're eating at your favorite movie. And it's not. And there is a reason. The thing is that what we also fail to recognize, that these medications are there to reverse your skin age. What happens is that what happens to all your internal organs? Skin is one of your organs. Maybe, yes, it is one of the largest organs of your body that you possess. It also is like the most expensive fabric that you will ever own in your lifetime, in this lifetime. So what ends up happening is that just like your heart, as you go through time, ages and fails, just like your kidneys, as you go through time, age and fail. Similarly, your skin also, you're nothing but a bag of skin that's holding your consciousness together. And as your skin goes through time and gravity and all the external and internal factors that you subject yourself to, they all come together and age your skin. Sometimes that aging can take place prematurely. What happens is that at that point, not only we want you to get control of your life as you live it, but also try some of these anti-aging medications. Now, the problem is that if you're in the United States, you have somebody like me pretty much in every town now who is like, I'm a very super experienced tailor, and we use it very cautiously and stuff. However, none of these medications are covered by your insurance. So they are your skin aging and decline, and your chronic skin failure is an out-of-pocket expense. The management of your chronic skin failure is an out-of-pocket expense. You have to pay all your other problems, and then you realize that your face has fallen apart by the time you're 45, 50. And at that point, you very sadly realize that you have to go and purchase these treatments, and to go to the right people is not inexpensive. These are very super expensive medications. So if somebody really knows how to do them and how to be true to you, because they're not going to bot you or turn you into somebody else, those people are not cheap. Like if I can't do some of my stuff myself or with the help of my team at this office, and I have to go somewhere, I'll probably find the most experienced tailor in town, and those people I know, they're not cheap. There's a line out there. There's like a you'll be waitlisted. Are virtual consultations free? How can I book one? Virtual consultations are not free. However, if you take the time and inconvenience to show up to my office, 15 minutes of my time is free, because if you're going to come and honor us by coming to our place and meeting us to seek our opinion, we will not turn you away without a recommendation. So for sure, coming in-person consultation is free. Yes, you can book a virtual consultation also. A lot of people who book virtual consultations from me are usually doctors or estheticians or nurses who are seeking to purchase a machine or get into this business. So they want to know how we did it, because we just started doing early on. So, it can, by spending a little money, it saves them a ton of time and also money, because we'll just help them not make some of the expensive mistakes that we made. That's what you pay for. Where is Juvanni located? Juvanni is located in Yonkers, New York. It's Westchester, like maybe 25 minutes away from Manhattan, New York City. How long does Botox last? So Botox is an anti-aging medication that is an injectable. It is placed in certain muscles around your face. I like to do it a little bit around your upper face, and I also like a little lower face treatment. You may have seen some of my videos. If you follow me, you may see me injecting myself. So it is an anti-aging medication. It relaxes and smooths out the muscle. I call it a meat tenderizer. It is like a tiny piece of medication that will allow your muscle not to scrunch so much. So as you scrunch your face, what ends up happening is that you create these folds into the fabric that, as you go through time, they get etched across your face. When you're younger and when you go to sleep, your skin heals itself and smooths itself out, and wherever you've lost collagen as you're folding your skin again and again, throughout the day, it just heals it and refurbishes it. But as you get older and your body is no longer making the amount of hyaluronic acid molecules that hold your skin and face together, then you see that not only your face goes through a volume loss, but also some of the areas where the skin is being impacted again and again with your movement, that with a very harsh movement, that area line can get etched into your skin. So basically, Botox is going to reverse that movement. Botox does not stay in your system for too long. Botox only, it's like a targeted thing. It goes into your muscle and basically knocks out all the receptors that are there to crunch the muscle. So this impact usually lasts for 2 to 3 months, not more. And especially if you're going to do like a baby Botox treatment, which is like a very, very tiny dose, where we don't want to give you like a stiff face where you have no movement. You can't like raise your eyebrows or frown at someone or smile or be able to talk. If you don't want to look frozen, then you put a very tiny dose. And that very tiny dose is going to make you look natural. It's going to keep your skin nice and smooth for 2 months, maybe 2.5 months. And listen, when you're younger, this thing tends to last longer. Your Botox dose is your skin age. It's not your chronological age. So chronologically, I may be in my 50s, but my Botox dose is that of a 25-year-old. What I tend to say is that the facial skin, I've kept it at a certain level. Now, I didn't just keep my skin at that level by just injecting Botox. I also do many of the other things that are also required, like I eat well, I sleep as well as I can. I also do something called skin infusions, which are amazing ways to just rejuvenate your skin and your system. They're like an oil change for the skin, because remember, when you do Botox and fillers for your face or any other facial treatment, you are basically just treating your skin locally in just a little pot. However, your skin is all over, and you have to do anti-aging. I recommend infusions regularly for people, especially people who are my age, to make sure that your skin stays healthy and intact, not just in this particular area, which is of course your most visible area, and this is how not only you recognize yourself but also other people recognize you. So it's super important. I totally agree, and it needs more attention. But also, as you take care of this, I don't want you to just ignore the rest of your skin surface. And IV vitamin infusions is like another way to basically help your entire skin. Yeah, there are Botox, and there are some clones of Botox that can last you a little longer. However, in my experience, Daxify or Xeomin or Jeuveau may or may not last as long. Some may last a little longer. However, it's about how regularly you do it, how you tailor it, and how you customize it to you. Because remember, the person who's getting these treatments, that person's perception of self is the most important thing. It's not about me perceiving you. It's not about your friend perceiving you. It's not about parents looking at you or your enemies hating on you. It is about you looking at you. And if you are okay with it, then it's fine. To get you to that level, we have to be very meticulous. People who like me are the ones who are super meticulous about their doses. We don't just we don't overdose you. Botox is a very common addiction. There are people who can't stand a single line appearing on their face. That's like crazy. That's a craziness. Do you do Botox for headaches? We do Botox for headaches. We do Botox for migraine headaches. Now, what is the difference between the Botox that you do for migraine headaches and the Botox that you do for anti-aging? Botox that you need for migraine headaches is a very, very high dose. The detail is in the dosing. For migraine headaches, basically they are targeting your entire muscle. So they will inject you up here, they will inject you in the back, a lot of units. They will tenderize the entire face. So that's a very high dose. However, for anti-aging, the dose is very little because we're just taking care of certain areas of your face only. When you relax some of the muscles that tighten and can cause like a band-like ache, messing up your perception of self or the way you experience life, then I always recommend Botox, because I think that Botox is so much more impactful for migraine or even TMJ than any oral medication. Pretty much any oral medication. Every other migraine headache medication should just close their factories and leave. They can't because insurance doesn't cover. Because for Botox, you'll have to go find a doctor who's going to inject it into you. And it's for sure not cheap. It's fairly expensive. So anti-aging is currently a very clunky process because the head and neck has to be treated a different way. The rest of the body has to be treated a different way. The pelvic area has to be treated a different way. Does breath work help with anti-aging? Yes. Listen, breathing is a way where you sustain your body. Your breath is you. When you stop breathing, what happens? It's done. Your breath is one of the ways that you fuel your body. Remember, in the end, humans are nothing but a chemical reaction that's occurring under your skin. And that chemical reaction is the air you breathe in helps you carry on all the functions. The main fuel for our body is the air. Then, that gives us the energy, that gives us the sustenance. So how you breathe is super, super, super important. I would suggest everyone to go and find a breathing expert and get some exercises for themselves. Usually I like your breathing exercises to be done alongside your meditation. So remember, just like your sleep is very important, just like moving your body is very important, similarly, meditation for your system is very important. Actually, if you do not follow my podcast, please check it out to the link in my bio, and checking out the breathing exercise video that I actually just posted, where my teacher showed us a few exercises. If you find that useful, then please go and connect with my teacher. You're most welcome. I posted her information in my show and on my podcast, because not everything is suitable for everyone. Your body is a vehicle that is carrying your consciousness. How do I find a good injector in my area? Like, how do I know if they're good? So usually injectors become good with time. It is just, it's a skill that you learn, and as you go through time, you become better and better at it. There are some people who are just natural at it because they are either surgeons or have done a lot of work with skin or dermatology and stuff like that, and they're probably good with their fine motor movements of their hands. However, when you want to become an injector, which also is another word of saying a skin tailor, when you become a skin tailor, you just become better at it with time, because the more faces you work with, the more different types of skins that you work with, that's what makes you better. And one good way of knowing is that if somebody has been around and in business for 7-8 years, that means that they've learned their craft. Usually good injectors are just not cheap, because a good injector is also probably using very good tools and very good medications and stuff. And like, if anybody does all the right things, the things are expensive. Can I do sports if I just had Botox or PDO? Not right afterwards. If you've done PDO threads, one thing that I tell people not to do is to lift weights. As far as Botox is concerned, we basically tell you to not work out or not do anything for like a few days. You have to be careful for at least a week. You do not want to go and do massages or lay on your face or do headstands and stuff, because we're placing the medication in certain muscle groups and we don't want it to move to muscle groups that we didn't intend it to. Do you do Botox for excessive underarm sweating? Yes, Botox is used for underarm sweating. It's called hyperhidrosis. So when you are very sweaty, usually what happens is that we tell people to do it like every 6 months or so. When you do underarm Botox, we also recommend to do like a laser hair removal in that area because that's also going to improve your symptoms. Sometimes people sweat around here, around their hairline, and that also is like with Botox, it relaxes. Sometimes people sweat in their palms, and that also gets injected with Botox. I heard Botox was discovered by accident. Is that true? Yes. So there were two ophthalmologists who were working on Botox for a totally different reason, and they realized as they were doing these trials, they found out that people they were injecting were looking younger and nicer, and they had less wrinkles, and that's how they realized that this is something just way more than just relaxing the spasm of eye muscle. Is there any myth of anti-aging that you can debunk? The myth about anti-aging that I would love to debunk is that you need surgery and you need a lot of medication to feel young. And I think that is incorrect. If you start some of these non-surgical treatments, even at very minute doses, they will do the trick for you for a very long time. Can Botox and fillers be done together? Yes, different areas can be done together. So if you're doing Botox up here, you can do fillers in the rest of your face. And sometimes if you're doing like a little tiny Botox in your depressor muscles over here with a little bit of filler, we have done that too. What do you think of United States medical system? Listen, at least there is a system. I am originally from a third world country where they would love it if we have like a basic system where diseases are taken care of, where old people are taken care of, where children are taken care of. I think that United States healthcare system is one of the best in the world. And it is way better than the systems in England or in Canada or in some other parts of the world, because there are places where if you'd call a doctor, your next available appointment would be like months and months later. However, even this system can be improved because this system sometimes ignores some really important aspects of health and wellness. For example, skincare. I believe that there are so many things that can be done and should be done. What can be done if I'm a food addict? Again, addiction is a very big obstacle in path of anti-aging. One problem with addicts is they learn to be dishonest with themselves. And dishonesty is also a part of the addiction. And usually when people who are addicts and they learn to recover from whatever addiction that they are battling at that point, one of the main things that allows them that it's never really cured, but that sustained recovery is to be honest with themselves. And they have to not only be honest with themselves, but they have to find somebody else other outside of them who can keep them honest also. So dishonesty is also an addiction. So food addicts, what ends up happening is that they gain weight. And they continuously gain weight because they just can't stop themselves from eating, and may have formed cultural norms where if you're smoking, somebody's going to say something to you. If you're drinking too much, somebody's may say something to you or not. If you're a drug addict, somebody may tell you like, dude, go get some help or whatever. But when you're eating a lot, and you just can't stop yourself from eating all the harmful things that you are consuming, nobody's going to tell you to stop. One of the things that I like to do is to put our food addicts into our food addicts boot camp, which is basically an HCG 2-3 week program. It's like a 3-week program. It takes like usually 21 to 23 days for a human brain to form new circuits. How you visualize food, how food triggers you, how to remove those triggers for yourself. Because remember, we can only assist you by giving you some medication that can pacify your brain and food doesn't trigger you anymore. But most of the work, most of telling yourself that what is not good for you and how to stay out of that is your job. So we're basically become your cheerleaders. And that is what I really recommend to people, and especially our food addicts. And listen, that is something that I am a food addict in recovery. So do I stumble every now and then? Yes, I still do. And but do I have created a group of honest people around me who will tell me, who will speak truth to me? And you need those people who you allow to say the truth to you, and you know that they're well-meaning, you know that they're not this to pull you down. And that's what you need. You need like somebody who is your friend and who's your ally whenever you're ready to fight your addictions. Thank you. These are great questions. And how long have you been a doctor for? I have been a doctor for around 30 years. Wow. That's a lot. All right. I love you guys. Thank you for watching. And I hope that in this talk, by watching this, you found some important pearls of wisdom. And if you didn't, let me know. I'll try better next time. Ask your questions, and I'll come back and answer them. So until then, bye.